Hello, I'm Dr. Stropke, Superintendent of the Keystone Oaks School District, and this is our 8th in the series of back-to-school videos that we are doing with our opening plan for the new school year. Today I'd like to, in this particular video, I would like to talk about the COVID-19 cases in schools and how we're going to handle some of those cases. And I'm going to tell you right off the bat in this video, you may see me reading a little bit more on this one than others because this is very confusing. It has a lot of details to it, and we're going to have all of this information posted on our website very soon. As I said in other videos, some of this information is still changing, both from the County Health Department, the Pennsylvania Health Department, and also the CDC. So I'm going to do my best with you today, talk about the COVID cases in schools. So first of all, here at Keystone Oaks, we have been working very closely with the Allegheny County Health Department to create a consistent plan amongst all of the school districts in Allegheny County for handling suspected or confirmed cases of COVID-19 in our schools. And so working with Dr. Bogdan at the Allegheny County Health Department and her people there, they have really, in the last 2 weeks, been providing more information to the schools on how all schools in the county, parochial, private, can all be consistent in identifying the cases. Late last week, we received additional information from the Pennsylvania Department of Health and Education on this topic. And if you go on the Pennsylvania Department of Education's website, you will find 2 new documents. A document that was released on August the 13th. So on Thursday, August 13th, there's a new document listed there. Talks about recommendations for pre-K to 12 schools following identifications of cases of COVID-19. So we have that there. And in addition, there's another document, the COVID-19 symptomatic K-12 student or staff process, and it's the flow in the process. And I'll talk a little bit about these and things that we are doing. There are 2 documents. You can go on the Pennsylvania Department of Education's website. It is www.education.pa.gov, and you will find these on right there on their website. So the COVID-19 has been a very popular question that we are receiving from the community. In particular, how are we handling these cases? Because we are planning to only have about 30% of the students in the building on any particular given day, which was going to allow us to maintain proper social distancing to 6 feet. The good news out of all of this is that a single case of COVID-19 that we see, that occurs and so on and so forth in the schools, is not likely to force an entire school building to have to close. So that is the good piece, because we're going to have a small. So we have really tried, because of our instructional models, which I described to you in a former video. What we are now able to do is the contact tracing. We have less people in the school buildings and so on and so forth. That is going to make it a lot easier if a case should arise. Depending on the specific circumstances, and once again I stress that, every case can be different. So depending on the specific circumstances, a single case also does not necessarily mean that an entire classroom has to be forced to quarantine either. So please keep that in mind. Classroom, building, or district closures will be determined by the number of cases within the school building or the district, as well as the incident and positivity rates within the county at that time. And that is actually seen in this document that we have here, talking about the level of community transmission in the county, the number of cases of COVID-19 within a 14-day period within a school, number of cases within a 14-day period here, and broken down bit by bit what we do, and also if the county is considered to be in the low transmission, the moderate transmission, or the other level that they are referring to here is the substantial transmission. So once again, this grid is found on the Pennsylvania Department of Education's website. I cannot stress it enough. This is why maintaining social distancing, the 6 feet, wearing a face covering, and doing your part to stay healthy is so important, not only when you're in the schools, but also when you're in your homes and when you're within the community. Because the spread of COVID-19 is obviously happening throughout the community, whether that be our local community, our county, our state, our nation, our world. And the school is just one particular aspect of the entire community. So once again, maintaining social distancing, the 6 feet, wearing a face covering, and doing our part to all stay healthy, good hygiene, is so, so important. So, if somebody becomes ill with COVID-19 symptoms while they are in any one of our buildings, okay, they are going to follow these steps. Okay? Number 1, the individual will be immediately placed into a quarantine room. Every one of our buildings under the CDC guidelines was required to have one room that would be marked as the quarantine room. That's all it's being used for. Number 2, the student or the individual, because it can also be an adult, okay, will be sent home with a referral to see a medical provider. If that individual tests positive, they must remain isolated at home for a minimum of 10 days. They may return to school when at least 24 hours without a fever, and that is without the aid of medication. So if you go 24 hours without a fever, and that's without using any fever-reducing medication, then you can return. That has been a change. Earlier, you may have seen a video, you may have heard that was 48 hours. It's been changed to 24. Not from us, from the CDC. Also, they may return if their respiratory symptoms have improved. The school is going to and is required to conduct contact tracing in consultation with the Allegheny County Health Department. Anyone who meets the definition of a close contact will be required to quarantine at home for 14 days. A close contact, by definition, is someone who has been within 6 feet of an individual for 15 consecutive minutes or more. Contact tracing goes back to 2 days before the symptoms onset, or for asymptomatic individuals, the 2 days prior to the positive test results. So let me repeat that again. Contact tracing is going to go back to 2 days before a symptom saw its onset, okay? Or, if you're asymptomatic individual, 2 days prior to a positive test. This all comes from the Allegheny County Health Department, and our nurses have been going through this and have been trained in this as well. Okay. All areas where the student or the individual has been will be closed for 24 hours or as long as possible before being cleaned and disinfected. This is still by the CDC, to allow the particles that are in the air to settle and so on and so forth before the cleaning comes in. Still a guideline of the CDC. If a student or a staff member in the district lives with someone who has COVID-19 or has COVID-19 symptoms, okay? Once again, you're living with somebody who has COVID-19, or you're in a home, or you're living with somebody who has the symptoms of looking like it's COVID-19. That individual needs to be quarantined at home for 14 days. And I want to stress the fact that if somebody in your home has it, being quarantined, that person needs to be quarantined in one room, part of the home. You need to be in another part of the home. If it happens to be, you need to be separated. If the person with COVID-19 is able to isolate at home, other members of the household also need to quarantine for 14 days. As I said, keep the separation. If the person who has COVID-19 is not able to isolate, the other members of the household have to remain in quarantine for 24 days. I want to stress that if the person with COVID-19 is not able to isolate in their home, then the other members in the home, if you cannot keep separated, all must remain home for 24 days. Those are calendar days. I'm not talking about school days here. I'm talking calendar days. 24 days. So, for example, if an elementary student has a parent that tests positive for COVID-19, and the parent cannot remain in a separate area of the house for 10 days, they cannot isolate themselves for 10 days, then the student and the other family members who are in that home will be quarantined at home for 14 days, will be quarantined at home for the 10 days that the parent is required to isolate, and then an additional 14 days. Okay? So I'll repeat that again. If an elementary or any student, doesn't have to be elementary, anybody, okay, if a student has a parent that has tested positive for COVID-19, and that parent cannot remain in a separate area, separate room of the house for 10 days, which they are required to do, then the student and everybody else who lives in that home is required to quarantine at home for 10 days, that the parent is being required to quarantine, and then all those people then have to go an additional 14 days. That's where you're getting your 24 days. Students who are isolated or quarantined at home will still be able to participate in their classes. You'll be able to go right into the online synchronistic learning, which is our option 2. You won't be able to miss a beat. Now, I will tell you this, that at the elementary level, you will have a different teacher, because we have, in the elementary level, we have teachers that are just designated to be teaching the kids that are synchronistic. So there will be a change in teacher for a time being while you're getting official, but you won't be missing anything in the curriculum. We'll be following the same curriculum. All of our school nurses, members of our core pandemic team, members of our administrative team, okay, are all in the process of completing a contact training course so that they can actually go through this and understand, okay, this. So another thing I would also like to stress to you, that we've gotten information from the Pennsylvania Department of Health, okay, with regards to when should you be staying at home. As you know, here at Keystone Oaks, we are not going to be taking temperatures at the door. Those need to be done at home. As we've said so many times, if a child is sick, they should not be coming to school. If an adult is sick, you should not be coming to work. You need to stay home, particularly if you have a fever. We've said that all the time, but more now than ever, if you have a fever, you need to stay home, okay? So, what we will be posting is a document from the PA Department of Health with regards to a Group A and a Group B. And once again, I have a sheet here. You'll see that on our website later on. That if you have one or more of the following symptoms, you are considered to be a Group A individual. If you have a cough, shortness of breath, difficulty breathing, you have some other type of disorder. That disorder could be like from taste, it could be smell, it could be, all kinds of number of things, okay? If you have one or more of these particular symptoms and you're in a Group A, once again, you need to stay home if you have that, if you have one or more. There's another group, there's Group B, okay? Now, if you have a fever, okay? If you have the chills, okay? If you have a headache, if you have a sore throat, if you feel nauseous, if you feel fatigued, if you have congestion, runny nose, so on and so forth. And there's a couple of other items on here. If you have 2 or more of those symptoms, okay, in Group B, okay, all right, then once again, we need to stay home, okay? You need to stay home. That is so, so important. I can't say enough, because coming to school, even though you may have your masks, okay, you have your mask on, it still could be transmittable. So when we're not feeling good, we need to stay home. I hope this video has helped you somewhat to understand a little bit more. As you see, our information is on our website. You'll see the various things from the Department of Education. You'll see a flow chart. Eventually there will be another flow chart that will be posted on there as far as what we will be doing, as far as following the steps and so on and so forth. Please take a look at those. If you have any questions, reach out to your school's nurse. They will be able to answer the questions to the best, since they're going through this right now. But I cannot stress enough the fact that if you're not feeling well, you don't come to school. And we will be doing all of the precautions that we can to make sure that the buildings are healthy and so on and so forth. Once again, thank you. Thank you for your patience. Thank you for your understanding. Be safe out there. Be wise out there. Be cautious out there. And let's fight this pandemic that is out there, so we can put an end to this and it's not affecting our schools. Thank you.